Good morning. Ladies, are you tired of wearing and buying Depends? Well, I couldn't blame you. Yes, they may make you feel more comfortable out in public and avoid soiling your clothes, but that damp, irritating pad or special pull-ups can certainly be irritating in the long run. That's why we want to talk about urinary incontinence, because Depends isn't the ultimate answer. Now, if you watch television or listen on radio or get on your computer, you would think that that's the only thing available, but it's not. There's a lot available to you to help control your urinary incontinence. Probably one of the common causes of incontinence is what we call stress incontinence. And that comes from a lack of support to the urethra. In the female, the urethra is very short. And with coughing, sneezing, laughing, other activities, I hear a lot jumping on the trampoline with my kids. We have ladies who say, I leak a little bit of urine. And it's so annoying and aggravating. Well, this comes from a lack of support to the urethra, which causes the urethra to move and pretty much wiggle whenever you're sneezing or coughing or carrying on other activities. So this is a very common cause of incontinence and is easily corrected in today's modern medicine. Now, I've been doing urinary incontinence for over 40 years, and I can tell you, if you listen to your mom or a distant relative, they probably will tell you that fixing urinary incontinence is awful. And certainly 35, 40 years ago, it was pretty bad. But we have made such tremendous advances in treating urinary incontinence that we now can very simply and easily correct most areas of urinary incontinence without any difficulty. Now, there are other kinds other than stress incontinence, of course. Overactive bladder is very common in ladies. And there you have a situation where you may be, anytime you go anywhere, you're looking to see, well, where's the closest restroom? Or as I've heard some patients say, I don't even want to go anywhere because I'm afraid I'll get out and won't be able to control myself whenever I get out in public. And of course, ladies, different from us guys, it's hard to find a nice, clean restroom to use. So, yes, it does create some problems for you. But overactive bladder can easily be treated. And associated with that is urge incontinence, where you get the urge and you don't have enough time to get to the bathroom, and therefore you tend to leak. All of that is easily corrected in today's modern medicine. And there's no sense having to put up with it or wear Depends because you cannot control your bladder. It's just not necessary. So certainly it is something that we can correct, things that we can help you with. So don't hesitate to bring that to our attention if you're having those kind of problems. Other types of incontinence may involve overflow incontinence. And this is where you don't get your bladder empty. You ladies have a great ability to hold it for a long period of time. And I'll tell you, us guys do not have that ability. But teachers and nurses and folks like that just don't get much of a break during the day will find themselves over time developing habits where they only go empty their bladder on rare occasions. And what that ends up causing is overdistension of your bladder and weakness of the detrusor muscle, which helps empty your bladder, and eventually you just don't empty as well as you should. In addition, that muscle becomes quite sensitive and will go into spasm, which will cause you to leak. There are many things that we can do to help women with incontinence, especially when it's involving overactive bladder or incontinence related to inability to empty your bladder completely. Then granted, in the field of urogynecology, there can be a lot of mixture of different types of incontinence. So you may be having incontinence due to not only problems like overactive bladder or stress incontinence, but you may also be retaining urine from pelvic floor defects. And we'll go into that in more detail in a future session. But the important thing is, in urogynecology, we can address any and all of those as we approach trying to correct problems that you may have with incontinence. So don't worry about having to support the industry of Depends, diapers, and pads. Realize that there's so much that we can do to correct these problems, and most of the time is a lot simpler than you can imagine. You won't believe the patients I've had said, I cannot believe I put up with this for so long, and all I had to do was these simple steps, and now I'm dry again. I've actually had ladies who've had hysterectomies for fibroids or awful bleeding, but they also had incontinence, and we fixed their incontinence at the same time. And the thing they were most pleased about was not the lack of the periods, which obviously they were glad they were gone, but they were dry, and they didn't have to worry about embarrassing themselves in public or wearing pads or diapers to keep that from occurring. So realize there's a lot that has transpired over the past 35 or 40 years in the improvement of treatment of women's urinary incontinence. And we certainly want you to be able to take advantage of that as you go forward in your life. Now, is this for older ladies, younger ladies? It's for all ladies. Anyone can have problems with incontinence for numerous reasons. So it certainly behooves you to identify why you're having the incontinence, and then seek ability to go ahead and get that fixed in whatever way that would be. Sometimes it's just a matter of getting on the right medication, or it might be some special training or how to empty your bladder and pelvic floor training. All of those are available to you, and we certainly like to take the most effective and efficient clinical pathways to treat women with urinary incontinence. You may be saying, well, do I have to have a referral? Well, no, you don't. You can just call and make an appointment. We'll be glad to assess your incontinence, tell you why we feel like it's going on, order any tests that may be necessary, and then discuss with you in detail why a certain medication or procedure might benefit you in correcting your incontinence. Many people have asked me, said, well, I already have a doctor. Do I have to change doctors? Well, no, you don't. We can certainly address your incontinence. We can correct your incontinence. You can continue seeing the primary care doctor or other physicians that you're seeing now without having to say, well, I'm switching doctors and changing everything in midstream. The most important thing is we want it to be as comfortable for you as possible. We want it to be as easy for you as possible. But most important, we want it to be as effective as it can possibly be, so that you don't have to worry about running to the grocery store or the drugstore on a regular basis, buying boxes of Depends, etc. Let's see here. Lady, well, thank you so much, Lady. Lady, we appreciate the kind remarks. We love you too, and thank you so much for the kind remarks about our staff. And I'll be honest with you, I am so pleased with our staff that they have really reached out to our patients. I hear all the time patients say, you have the best staff I've ever come in contact with. And you're right. They are wonderful. They care about each other, but most importantly, they care about our patients. And they want to make sure their experience in our office is the very best that it can be, and that they get the kind of service to our patients that they can possibly do. So, ladies, don't worry about incontinence. It's something that can easily be addressed, something that can easily be fixed, and it's something that, when it's all said and done, you will probably say, boy, I wish I'd have done something about this a long time ago. But it's never too late to get started.